Hello, boys and girls, those who bounce in between. It's Comrade Dankey here again today. I hope you're doing well. I hope you don't have the coronavirus. I was on Twitter and I read a story by a user named Sketchy Lady, and it's a very scary story because it shows you just how incompetent and unprepared we are as a country to handle this virus. So she says, I live in Seattle. I have all the symptoms of COVID-19 and have a history of chronic bronchitis. Since I work in a physical therapy clinic with many 65-plus-year-old patients and those with chronic illnesses, I decided to be responsible and go get tested. This is how that went. I called the Corona hotline and was on hold for 40 minutes and gave up. I looked at the CDC and Washington public health websites. They told me to see a primary care doctor, but there's no information about testing. I called 2 primary care doctors. One told me they don't know where to get testing and that I should not be seeking out testing. Wow, that's very irresponsible. The other one told me to go to an urgent care or emergency room. I called the urgent care. They also had no idea where the tests are, but told me to call the hospital. So I called the hospital. They don't even have tests, but transferred me to the COVID-19 hotline to answer my questions. So, in other words, she's come full circle. She called the hotline. They told her to call the CDC. CDC told her to call primary care. Primary care told her to call urgent care. She called urgent care. They told her to call the hospital. She called the hospital. They told her to call the fucking COVID-19 hotline. So around and around we go, ladies and gentlemen. Is this what we have in place for people who are feeling like they might have the coronavirus? Is this what we have to go through? So since I was transferred on a medical provider line, I actually got through to the COVID-19 hotline. Progress. The lady with the hotline was very kind and professional and understood my concern about my own health and those at my clinic, which is currently being sanitized. However, I was told I do not qualify for testing and was not given a timeline or info on current resources. Wow. Okay, so who does qualify? Apparently, it's those who have been out of the country in the last 14 days and those who have had contact with one of the few people who have been tested and come up positive. That's it. So sorry, it doesn't matter how many symptoms you're feeling. It doesn't matter if you're like 90% sure you've got the fucking coronavirus unless you've been out of the country in 14 days or are in contact with someone who's tested positive, even though it's very, very hard in this country to actually get tested. You are not going to qualify for a coronavirus test. So the only way, this is Sketchy Lady, she says, the only way I can get treated is if my symptoms get so bad I develop pneumonia or bronchitis, which is very likely the case. Then I'll be in the ER in quarantine for several days while waiting for a test and for the results to come back. This is all incredibly frustrating because I am trying to do everything right in a system that punishes moments of weakness like taking days off. It's also scary to know that I won't be able to go get help until I need life support. To sum it up, this is not contained. No one knows what the fuck is happening. I can't work. Wash your fucking hands. And so below she gives the number for the COVID-19 hotline. That's 1-800-525-0127. Don't call them unless you're experiencing all the symptoms or have been exposed to a case. Leave the hotline open for anybody who might need it more than you. Any other question can be answered on the CDC, World Health Organization, or WA public health sites. Alright, so that was a terrifying story. Basically, if you are exposed to coronavirus in this country, you will have no way of getting tested for that until it's probably too late, until your symptoms have gotten really, really bad. This is pretty much emblematic of the entire U.S. healthcare system and its failings. We don't try to prevent anything. We don't try to prevent people from getting sick. We wait until it's to the point of disaster where they're crawling into the emergency room piss and vomit all over themselves, and they're wanting care then. This is how we do it here in the United States, the wealthiest country in the world. This is how we treat our people, our citizens. Contrast this with what they did in China. At least in China, they did fucking proactive action. They quarantined cities. They banned the consumption of wild animals. Numerous other things. If you live in China, or if you live in a country that has reasonable epidemic outbreak protocols, let me know in the comments below. Stay safe out there, everybody. Wash your hands. Avoid public places, crowded public places, if you can. And try not to touch your face. Don't touch your face. And stay safe out there.